This portion of the program is brought to you by Bronson Battle Creek, nationally recognized with an A hospital safety grade from the Leapfrog Group for patient safety at the highest level. We're going to talk a little bit right now about the Bronson Birthing Center, and Dr. Karen Garcia, newborn hospitalist with Bronson, is our guest right now. Good morning, doctor. Nice to see you.
Hi, good morning.
Yeah, I just found out a kind of an interesting fact. Probably doesn't happen all that often, but you had your own baby there.
I did. I actually had both my sons there.
Oh, my goodness. And now how long ago was that?
My younger one is 2, and my older one is almost 4 now.
Okay, so how long have you been with the birthing center?
So actually, I transitioned and started working with the Bronson Battle Creek BirthPlace in 2012. So I've been there for going on 8 years now.
Excellent. That's quite a while. Well, it is, probably one of the biggest moments of anybody's life. And you want everything to go right. You want to go in there with confidence. You want to go in there knowing that, the people there know what they're doing and have great equipment. What are the benefits of newborn hospitalist care for mom and baby at Bronson?
Absolutely. So I've gotten the chance to see the transition, how we've evolved the newborn hospitalist program over the past 8 years. And it's the way that we have it designed is that we have both our nurse practitioners and our physicians who help cover the nursery. So all of our babies are seen by both our nurse practitioners and our physicians on a daily basis. It allows for us to make sure that we are providing the utmost care, and we've made sure to standardize the care for our babies across the Bronson system.
Is that kind of unique? Are there some differences between our birthing center and the average one?
It is. So you have pediatricians that are specifically trained to help with anything that's going on from the moment a baby is born. And since we have our nurse practitioners in-house 24/7 with the physician backups, we always have someone on the ground available that is NRP or the neonatal resuscitation, trained to be able to help provide care for our babies.
Wow. I remember, this was, I don't know, I've been here 30 years, but I remember the first 10 years that I was here. That was one of the big news stories that this type of care, we weren't real strong in this community. And that has been a response not only by the community, but obviously by the hospital community and by Bronson.
Absolutely. And that's been one of the biggest things that we've been striving for, is just to make sure that, our community is getting the same care as anywhere else in the Bronson system. So we've been able to standardize antibiotic stewardship to make sure that we're reducing antibiotic usage unnecessarily, making sure that we are increasing our breastfeeding rates in our community, which we've seen tremendous improvements with over the past couple of years. We want to make sure that we've got decreased separation between moms and babies, not just physically in the unit, but also trying to reduce the transmission rates to the NICU, and having a mom in one city and a baby in another city. And the biggest thing is just, having that open communication with the families and making sure that that we're providing the best care for our families.
Mm-hmm. And not every family, not every young mother is lucky to have somebody who can help them. I mean, there are a lot of people that have, they're pregnant and they really could use some help. I mean, breastfeeding techniques and all that stuff. You guys do all of that.
Yes, we do. We actually have a very robust support system. So we've got different protocols to ensure that we're trying to encourage skin-to-skin techniques with our babies. We are a breastfeeding-friendly hospital, so we also have lactation consultants in-house. And we also have in our group multiple providers that are IBCLC, so certified lactation consultants. And we've also have nursing staffs that are certified lactation consultants. So it's been very fun to see how everything has evolved. And one of the newest things that we actually just added is we have a new coordinator for postpartum emotional support program, Gina, who just started in the past couple weeks.
Wow, that's a lot. And if people want to find out more, see how they can actually get in touch with the Bronson Birthing Center, what should they do?
Absolutely. You guys can go online to bronsonhealth.com/birthplace-BBC. And we also do have free tours available to the birthplace for any of our families, and you can sign up through bronsonhealth.com/classes.
That's fabulous. Well, Dr. Karen Garcia, newborn hospitalist with Bronson, we really appreciate you coming in and telling us about it today. It's just one of the things that is a mark of a strong community. That somebody's going to take care of pregnant mothers and make sure that we get that infant mortality rate down. And it is coming down, isn't it, in Calhoun
Yes.
County?
Yes.
Yep. Well, keep up the great work. Very nice to meet you. Thanks
Nice to
for
meet you
coming
too.
in.
Thank you.